Alterations in reproduction, sexually transmitted infections. Sexually transmitted infections are spread through sexual activity with an infected person. This is a significant public health problem. HIV, chlamydia, gonorrhea, hepatitis B, syphilis, and chancroid have to be reported to the CDC. HPV is the most common STI. STIs are usually easily cured with early and adequate treatment. Those that are easily cured are going to be chlamydia, gonorrhea, and syphilis. Social, sexual, and biologic factors also contribute to a high incidence. These people that contract STIs are ignorant of the transmission or means of prevention. These diseases may be asymptomatic because of the I can't think of the word I want to use, but because of a lot of casual sex, excuse me, we have an increased risk. Because of people having intercourse with high-risk partners or multiple partners can increase that risk. A failure to seek treatment. Excuse me, if people feel that they may have an STI, they might be very embarrassed and not understand the potential consequences of not getting treatment. So they just don't go to get treatment. Or they have a non-adherence to treatment, or even mutation of organisms really increases the risk to the high incidence of this particular problem. Epidemiology is going to study the occurrence, distribution, and causes of human diseases. The CDC, their role is to gather statistics, but it can be difficult to obtain exact numbers, once again, because not everyone seeks treatment and some are actually undiagnosed. Once again, there are reportable diseases. Those that are not reportable by law include genital herpes, hepatitis B, venereal warts, etc. Women do acquire STIs more often than men, frequently because of the environmental conditions and because of vaginal trauma. Statistically, the reported incidence of STIs is disproportionately higher in racial and ethnic minorities. This disparity could be the result of limited access to health care, poverty, an actual higher rate of disease occurrence, or more reporting by public health clinics where many in these respective populations seek treatment. Client teaching for those that are being treated and or being treated should include abstinence during treatment. They should not engage in sexual intercourse during treatment because until they have completed their treatment, they are still infectious. They need to use male condoms with the spermicide to help prevent transmission. They should also have their partner, or if they have multiple partners, they should also all be treated. If they are not, then that infection will just be passed back and forth. They need to urinate and wash genitals and the perineum following intercourse. And they also need to wash their hands and areas that are in contact with semen or vaginal mucus. Different antibiotics that can be used in the treatment of STIs include penicillins, which help prevent and treat infections caused by gram-positive bacteria. It can cause urticaria, hives, pruritus, or angioedema, and eosinophilia, and the Stevens-Johnson syndrome. These drugs are going to be like your nafcillin, amoxicillin, ampicillin, penicillin, carbapenicillin, piperacillin, ticaracillin. Cephalosporin is a broad-spectrum bactericidal. It is 5 generations. If they have an allergy to penicillin, they may also have a reaction to cephalosporins. And if that penicillin allergy is severe, it would be contraindicated. These clients may also have mild diarrhea, abdominal cramps, rash, pruritus, redness, and edema. So there are 5 different generations. So cefazolin is first generation, cephalexin, cefoxitin, cefuroxime are second generation. Ceftriaxone and ceftazidime are going to be your third generation. Cefepime is fourth, and ceftriaxone is going to be your fifth. Tetracycline is another antibiotic that inhibits the growth of many gram-negative and gram-positive organisms, in addition to some protozoans. And this is also a drug that is frequently used in clients that have severe acne. This drug should be avoided in pregnancy, lactating women, and children under the age of 8. It can permanently discolor, or it can discolor permanent teeth. We can have tooth enamel hypoplasia. It retards fetal skeletal development. These clients can also have photosensitivity. In other words, they're sensitive to light, and it can exacerbate lupus. These drugs are going to include like doxycycline. Excuse me, your quinolones are broad-spectrum antibiotics for organisms that might be very difficult to treat. We may see corneal staining and precipitates with this drug, taste disorders, and nausea. And one of the most common quinolones will be ciprofloxacin. Carbapenems are going to be your broadest spectrum antibiotic for complicated body cavity and connective tissue infections. It is contraindicated in anyone that has penicillin anaphylactic reactions. It can cause drug-induced seizure activity, cross-sensitivity with that penicillin allergy. This is going to be your imipenem and other drugs. So question, true or false? Excuse me. 3 STIs are easily cured if caught early and treatment is completed as prescribed. This is true. Remember, that is going to be chlamydia, gonorrhea, and syphilis. So let's talk about some of these infections. First one we'll talk about is chlamydia. It is one of the most common, reportable STIs. It is spread by sexual intercourse, genital contact without penetration, and it can be transmitted to an infant during birth. We can also see auto-inoculation. In other words, this particular bug can be carried on wet towels, wet clothing, etc., and a person can actually obtain that disease without sexual intercourse. So these clients may experience a sparse, clear urethral discharge, redness or irritation of the infected tissue, burning with urination. Women may also have lower abdominal pain, and men may have testicular pain. We diagnose it through microscopic examination, culturing the secretions, and potentially they may have concurrent infections, and we treat it with antimicrobial drugs. Gonorrhea is the second most frequently reportable STI in the United States. It does also facilitate HIV transmission. These clients may have a skin rash, fever, painful joints. Men may experience urethritis with purulent discharge and dysuria. Women may be asymptomatic. They may have white or yellow vaginal discharge. They may have some intramenstrual bleeding or dysuria. This also can be transmitted to the infant's eyes during birth. We diagnose with microscopic or culture tests and treat with antibiotics. Complicated infections may require hospitalization and IV with a multi-drug therapy or repeat antibiotic therapy. Treatment can be changed to a single IM injection of an antibiotic in uncomplicated cases. When gonorrhea is suspected in women, speculum should be lubricated with water because lubricants such as your KY jelly may cause inaccurate test results. So question, true or false? Gonorrhea is easily and quickly cured. That's false. If it's caught early, it can be easily treated and cured. However, these infections can be complicated and can require hospitalization. Syphilis occurs in three distinct stages. We have primary, secondary, and tertiary. It is only infectious during the primary and secondary stages. It's transmitted from blood of an infected person directly from a lesion, and it can also cross the placenta. We may see in the primary stage genital, anal, and cervical canker sores. In the secondary, we may see fever, malaise, rash, headache, sore throat, and lymph node enlargement. And with the tertiary, we may see a degenerative condition of the CNS, ataxia, which is that impaired balance or coordination, Charcot joints, which is a neuropathic joint disease, and cardiovascular complications. We diagnose by microscopic examination of these sores. We can do a VDRL test, an RPR, an FTA-ABS test, and CSF examination if it's indicated. Treat it with antibiotics. A single dose of penicillin G IM can be administered if it's primary or tertiary. We may also use tetracycline. Make sure that we do encourage follow-up examinations and lab tests to make sure that we have eradicated the disease. Herpes infections is a controllable but not curable disease. We have the herpes simplex virus 2, which is primarily genital or perineal lesions, and herpes simplex virus 1, which are primarily cold sores, but they can also be anogenital lesions due to direct or sexual contact. We can also auto-inoculate with this particular virus. In other words, we can transfer it just by touching infected articles or improper hand washing, etc., from one area to another. After the initial infection, the virus is going to remain dormant in the body until it's reactivated. This virus can be shed with an active virus or when the client is asymptomatic. So even when they are not having symptoms, they can still transfer this disease. These clients are going to have vesicles on the penis, the buttocks, the thighs, around the meatus around the cervix. They can have lesions, ulcers. There may be swelling of the lymph nodes in the inguinal area, flu-like symptoms, and headache. We diagnose through a microscopic examination. This is a self-limiting infection. We can do antiviral drug therapy that can shorten duration of an outbreak or decrease the risk of transmission, but the virus can still be transmitted. As with any antiviral medication, it needs to be started as soon as possible after the symptoms are noted. We have an exacerbation of the virus. It's kind of bared its ugly head once again. If we start it as soon as possible within 48 hours, then we can shorten that duration and severity. We need to make sure those lesions are kept dry. Clients should be encouraged to wear loose clothing. They should dry with a separate towel that is dedicated only to them. And stress management, because stress can actually cause an exacerbation. Genital warts are caused by the human papillomavirus, or HPV. It is the most commonly sexually transmitted infection. Transmitted genitally, genital to genital, genital to anal, or genital to oral contact. Again, auto-inoculation is a possibility. It can be transmitted to an infant's respiratory tract during delivery. It can also cause uterine cervical abnormalities, in addition to increase the risk for cancers. Many infections clear, but persistent infections can lead to cancers. Cervical cancer, testicular cancer. These clients may see painless or may have painless lesions that appear as a cluster of soft, fleshy growths on genitalia or the cervix, in the vagina, on the perineum, in the anus, the throat, or the mouth. Application of vinegar will turn lesions white, and then we can also do a visual inspection. We treat it limited infection with topical medications or topical chemical applications. If there is a substantial infection, surgical excision, laser therapy, electrocautery, cryosurgery, a parenteral administration of natural or recombinant interferon may also be required. Encourage vaccines. We do have vaccines to treat HPV and prevent potential cancers. So, true or false? If vinegar is applied to lesions suspected of being caused by HPV, they will turn white. That is true. So other sexually transmitted infections that we just need to briefly talk about are going to be like your Zika virus. That is transmitted by mosquitoes, but it also can be transmitted by sexual intimacy. It can cause microencephaly in newborns of infected mothers. And cancroids, the Haemophilus ducreibacillus, is characterized by a macule or a vesicle pustule formation that results in a painful genital ulcer, enlarged tender inguinal lymph nodes, and this one we treat with antimicrobials.